Principal data holdings at ICES are healthcare administrative data. These are data that are created in the routine encounters of the healthcare system. When a patient visits a physician, a claim is submitted to OHIP to pay for that contact, and a record is created. When a patient obtains a drug that's funded through the Ontario Drug Benefit Program, a claim record is created. When a patient is discharged from hospital, a discharge summary is created. These databases are not created for the purposes of research, but we use them for research. It's a secondary use of those data. This is very efficient because to go out and collect information on 13 million Ontarians would be a daunting and impossible task in a research budget, but to be able to utilize data that already exist and give us a complete population picture of the province of Ontario is a great privilege. These data are then de-identified so that the privacy of the individuals that they represent is strongly protected. But the de-identification is done in a way that still allows us to link encounters across the system so that someone who has diabetes can be tracked from their first diagnosis through which treatments they get, what specialists they see, when they have their first complication of diabetes, when they land in hospital with their blood sugar out of control, when they may have a heart attack or a leg amputation. All of that information can be linked to create a history for an individual patient. Now, of course, the interest is not reporting on the history of a patient, but by seeing which factors connect, we can then do research to understand which factors predict who is most likely to suffer an amputation once they've developed diabetes. Which patients are least likely to get the benefit of specialty care when they need it. So to understand issues of equity, population risk, and outcomes of the therapies that we deliver.